Are you starting? Okay, hi, hello there. My name is Raymond Chen. I'm a family physician and I'm here to demonstrate the diabetic foot exam. And here to help me is my lovely assistant, Elsa Martinez, RN. Say hi.
Hi.
All right, excellent. Okay, so let's look down here at the setup. First you'll notice there is a nice white cloth there for the patient. Okay, we laid that out right before. Now Elsa, would you please go ahead and remove your shoe? Actually, we would do both, but for demonstration purposes, we're just going to do one. Okay, pause it. So here we have a picture of her foot here. Looks like she needs a little care. Okay, haha, just kidding. All right, this is her real foot. Okay, so why don't you pan back a little bit? Okay, so for starters, we want to do a visual inspection. Okay, so for starters, we're going to do a visual, then we're going to do the touch exam. We're going to feel, and then after that, we're going to use the monofilament test. So let's start with the visual inspection. So I'm going to look around, notice the skin texture. Notice if there's a lack of hair, if the feet are shiny or tight, that would imply having a decreased circulation, all those things. We're going to look for any pre-ulcerative lesions, if there's any calluses, if there's any fungus on the toenails. Here, she's got toenail polish, and generally speaking, you want to remove that when possible, because then you can inspect the nails better. So you want to look for any ingrown.
You said fungus.
Right, and look for fungus. You want to look for deformities of the toes, deformities of the foot, bunions, Charcot deformities. You also want to check between the toes because things can hide there. Oh, look at this. There is nothing there. Okay, all right. Okay, so it's a common place for maceration, right? Diabetics get fungus between the toes. You can see all kinds of things. All right. Wow. Even her foot's turning red. All right, so make sure you check the bottom from toe to heel. All right, look at the arches, look at the skin for any excessive dryness. All right, look for any excessive warmth, redness, or any excessive paleness or cool skin temperature. Okay. Okay, and now we want to look at the pulses, and we check for the dorsal pedal pulse, which is right over here, and you grade that from 0 to 4. Okay. Then we want to look at the posterior tibial, which is right here behind the medial malleolus, right here. Feel there. And once again, you grade that from 0 to 4. Now we want to do the sensory exam, and we are using the Semis Weinstein nylon monofilament 10 gram. Okay. Now one way to do it is, for myself, I always tell the patient, listen, I'm going to touch you with this plastic hair because they see this wire and they think it's steel. I'm not going to hurt them. I just gently brush it on their foot like this and say, you're going to feel something like that. Touch you. Ideally, you don't want the patient to be watching you while you're doing this, because then they can cheat. So you have them look away or look up, and there are 5 spots that we're going to test. Okay, so if you can see this here, spot 1 is here, 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 and here. Okay, so 1, 2, 3, 4, 5. Okay, so, and when you do it, you need to apply enough pressure to bend the monofilament. Okay, and you ask them, can you feel that?
No.
No. Can you feel that?
Mm-mm.
Okay, so now we have to cut off all her toes, right? Because she can't feel a thing. Okay, so also note, if you have a callus, you don't want to test directly over a callus. Now, fortunately for her, she doesn't have any calluses. Very nice, smooth feet. So you're going to test the periphery around the callus, okay? You're going to do that. Obviously, you're not going to stick this in an ulcer if she has one. That's not a good place to test. Okay, so once we've done that, after that, we're going to stratify based on risk. There's high risk and there's low risk, obviously. High risk involves one or more of the following. We're talking loss of protective sensation, meaning if we find that any 2 out of those 5 spots there's decreased in sensation, that would be considered a neuropathy. Okay, and then comes absent pulses, any kind of foot deformity, a history of foot ulcer, or obviously history of amputation. If you have any kind of loss of sensation combined with any risk for increased ulcers, such as callus or deformity or absent pulses, you should be sending those off to podiatry or vascular podiatry. So, how often are we supposed to do this? Right now, for Medicare guidelines, we are required to do this at least once a year with the diabetic visit. It's recommended that if you find any high-risk situation, that a visual inspection be done at every visit. And anyone who has one or more high-risk foot conditions, you want them to be seen, to have an exam at least twice a year. Okay, so with that, that concludes our diabetic foot exam. Thank you for watching.
Do I get my pedicure now?
Please like on the, what was it, like on YouTube? Right?
Facebook.
Facebook, yeah, whatever. Okay.